I'm Mina Malik Hussain, and this is the Coffee Table, and today we're talking about rabies. It's kind of scary. It's also not what you think. And nobody has to get 14 injections in their stomach anymore, but that doesn't mean that it's not a really important and awfully dangerous disease that incidentally has the highest prevalence in Asia, and 45% of rabies deaths worldwide happen in Asia, and over about 1.4 billion people or so in Asia are exposed to rabies or are sort of under the threat of getting it. So we are very curious about this. Like, how do you get rabies? What's the prevention? What are the treatments available? And again, the 14 injection question is a very important one. As usual, I have to be a little flippant about things on the coffee table, so you will forgive me. I'm delighted to be welcoming on set with me today Dr. Ahmad Raza. If you have a pet in Lahore, you know who he is, but if you don't, he is a veterinary surgeon and an epidemiologist. He's a member of the Rabies in Asia Foundation Pakistan chapter. He is a specialist in contemporary dairy farming and is presently with Cargill Pakistan Agri-Foods. And we are joined all the way from Karachi by Mr. Mohammad Aftab Goher, who is the manager of the Rabies Prevention Training Center at Indus Hospital. He is the team lead for their Rabies Awareness Program and is also a member of Rabies in Asia. Welcome to the show, gentlemen.
Thank you very much.
Very nice to have you. I'm always really excited when I have an actual person on the set because it's become so rare now.
Yeah, likewise also, because I was given an option to,
Yes.
stay in the office and be on the camera. Yeah. I am a little bit uncomfortable.
But thank you, vaccinations.
Yeah.
So, Dr. Raza, I'd like to begin at the beginning. So when we say rabies, like what is rabies?
The definition is pretty scary, but before we get into that, I would especially like to, congratulate you on bringing this very important and, extremely sensitive subject, because people who are, working like Aftab Saab is in Karachi, it's a taboo here, and we will get into that.
Yes.
How does our rural community handle it? What are the taboos? How are people forced not to, declare that they have been bitten by an animal?
Oh.
So it's a very complicated situation.
Yeah.
But so rabies basically is a fatal disease of central nervous system.
Okay.
And that's the simpler part. Its transmission is through the bite of an infected animal when saliva, because the virus is in the saliva.
Okay.
So when that enters the body through a breakage,
so any
lesion, people sometimes talk about. I am already these days going through 4 cases also, humans, where they say that the skin is broken, but the blood, there was no bleeding.
Yes.
And then the teeth never got in touch with the skin, but the skin was scratched. So it doesn't matter. Whatever type of contact, it's extremely dangerous. And the first question that the human GP would ask is whether that animal that did that was vaccinated against rabies or not.
Right.
And that also means that there has to be a record of vaccination. So either there is a record that we call pet passport, for instance, the things that I normally produce.
Yes.
But either you have a pet passport or there is a story. And stories don't work in rabies. So pet passport would have the sticker batch of the vaccine coming off the vial and put in the pasted in the passport.
Yeah.
So that's the the real sort of essence. And it's a viral problem.
But transmitted through the saliva of an infected animal.
Yeah.
So, Aftab, tell me, with your work with Rabies Free Pakistan and your work with rabies, why is it that Asia, the region, is so exposed and so vulnerable to rabies? Like, I know that it does exist in other countries in the world, like Dr. Raza mentioned, you have it in the US, for example, which is a very developed country
Canada,
by all standards, and Canada as well. But what's going on in Asia that we are still struggling, the region is struggling with rabies?
Well, rabies, as Dr. Athar rightly mentioned, is a disease of animal, which is zoonotic disease,
Yes.
that can be transmitted to the human by the bite or a scratch of an infected animal.
Yes.
And that comes from the wild carnivoras, mainly foxes, bat, wolf, and all other wild carnivoras. And from an infected wild animal, somehow it is transmitted to the domesticated animal, mainly in the dogs. And that's how, if a person is exposed or is beaten by an infected animal, so that is transmitted to the human. And 98 to 99% across the world, rabies is transmitted through the infected dog.
Okay. Is that because humans have the most exposure to dogs and also cats? Because a lot of us are not exposed to jackals or wolves, for example.
Yeah, this is one of the main reasons. You're right. As I'm speaking, 60,000 people die of rabies globally as per the WHO statistics. And majority of the deaths occur in Asian and African countries.
Yes.
And if we talk about Asian countries, so all the India, Philippines, Bangladesh. So, unfortunately, in Pakistan, we don't have the exact number of rabies deaths or the disease burden. Because most rabies deaths occur in the remote areas, slums, and is extremely underreported. And which comes to the hospital is just tip of the, and majority of the patients die unreportedly. So this, and I can't really express the amount of pain one have to suffer after the disease. Once a dog bites someone, for example, in the arm, so the virus stays there, it multiplies and replicates the wound site, and then slowly, sluggishly, it travels through the peripheral nerve towards the, and from 6 weeks to 6 months, when it gets into the brain, so the manifestation of the symptom starts. It starts with feverish, headache, periods of mental confusion, which we call intermittent. At one time, patient will tell you everything, what he works, what happened, exposure, and then all of a sudden it gets very irritated, very agitated, and this is what we call intermittent mentation phase, followed by hydrophobia. Because of the muscle spasm, the patient cannot swallow water, and so as cannot swallow food and anything. So there's even a fear at the sight of glass of water, and also comes the aerophobia and sometimes photophobia. So these are the unique symptoms of rabies, and once the symptoms develop, so there's no going back. And there's
no treatment
one of the there's no treatment anywhere in the world. Once the symptoms there, so meaning this is irreversible, not treatable anywhere in the world. And I'm telling you, if someone sees a patient with rabies, and I've seen 3 patients in the last 12 days, and this is one of the torturous deaths one can imagine after a disease. And at the same time, we say this is 100% fatal, but is 100% preventable as well.
Yes.
And is a vaccine preventable disease if prevention is done timely and effectively.
That is the crucial thing to focus on, is that it is 100% fatal, but it is also 100% preventable. But I'm glad that Aftab mentioned the fact that a lot of rabies incidents or bites go unreported. So why is that, Dr.
Look, in the, especially in the lockdown, media has been, again, needs to be congratulated. They have really highlighted the issue of stray dogs in major urban cities like Karachi. There were these huge, sort of packs roaming around, biting people. And unfortunately, I don't know how and why that happened. There was no vaccine available.
Right.
Also for humans. So, you know, and apparently there is a shortage and people don't really know about it also. So, the unreported cases, it's only because people are afraid of it. There are not too many programs like the ones that we are having now, because just one off program on an important subject like this is not really going to, you know, help the general sort of public.
Oh, no.
So, you know, we will, you know, sort of, if we have a little bit of follow-up also. So,
but do you think also that it's an awareness thing as well? Even in rural areas, that, you know, if the dog or the animal that bit you doesn't seem to appear crazy, and in those traditional sense rabid, then you think, well, you know, it's fine, just wash it with soap and you'll be okay.
See, I would like to mention Dr. Sajid Maqbool's name here, and, you know, especially this this program that we jointly organized on rabies with Dr. Naseem from Indus Hospital from Karachi. I would like to mention her name also. We had such interesting, you know, facts mentioned in that during those workshops. In the rural areas, there is a totally different setup. You know, that's where the 70% population is.
Yes.
That's where the exposure of livestock to wild animals is like jackals, and because they all come, that's where the food is.
Yes.
And so they all come from their hideouts, hiding places into those you know, sort of areas to eat, and then they come in contact with the dogs, community dogs. You know, village don't people not just own individually, but there are these community dogs. You know, so they are the first guards. So they come in contact, they fight, they bite with each other. That especially during their breeding season, which is twice a year, once before the onset of summer and then once second time before the onset of winter.
Right.
So that's how the cycle continues.
Right.
And then once when a rabid dog gets into a yard that is full of livestock, so then they bite. And
like if they bite, then the livestock will get it as well.
Get it. And then the bite incubation period, actually there is no rule. That, you know, that it has to be, like they say in, I don't know whether it's...
In different diseases, you generally
like in
have an idea.
COVID, they say it's 10 days, but it can be 2 days. So then the virus eventually gets into the brain. That's where it multiplies, into this specific part. So the location of the bite is very important. If it's on the face, which is closest to the
neck or the
shoulder. If it's you know, if it's on the face, then the virus doesn't go through the spinal cord. It goes directly into the straight up. Otherwise, if it's on an arm or on a leg or somewhere, then it first goes into the spinal cord. There it travels at a specific millimeter per hour speed, and then it eventually gets to a specific portion in the brain. Because that's, you know, that's what my intention today was, not to just, you know, sort of show off, if I may say, as far as the knowledge about rabies is concerned. But these take-home messages for which are going to be extremely important for general public, for pet lovers. One simple example. Yeah, please, you go ahead.
I was just going to say we're going to take a very quick break at this juncture and then come back to more information, crucial information that you need to know about the rabies disease. And I'm going to drink a glass of water. Stay with us. We'll be back in a minute. Welcome back to the coffee table, where we're having a crucial and sort of spine-chilling conversation about the rabies disease with veterinary expert Dr. Ahmad Raza Khan and Mohammad Aftab Goher from the Rabies Free Pakistan project. So Aftab, tell me, now we were talking about what happens when you get rabies, and it's terrifying, but like you mentioned, it is fatal, but it is also completely preventable. So tell me more about the work that Rabies Free Pakistan is doing to create awareness and to vaccinate animals, and to sort of, what are the preventative measures that are being taken, and how can we sort of get onto that?
Okay, so there are two major components of rabies prevention.
Right.
So first is human rabies prevention, which is an integral part of it when there's a dog contact or a dog bite happens. So as per the WHO guidelines, rabies prevention can be done effectively, properly, with the recommended guidelines, in which, first of all, a dog bite wound must be washed for 10 to 15 minutes with any ordinary soap and water. And by proper and early wound washing can reduce 30 to 40% chances of developing rabies. Because the virus stays in the saliva of an infected animal. Assume that's there at the wound. So once you rub it with any ordinary soap, actually it denatures the virus at the wound site. So that dangerous virus, that deadly virus, gets neutralized at the wound site. And by flushing it with water, you can reduce the amount of virus introduced into the wound. So early proper wound washing is very, very important. And after that, a dog bite victim should go to a hospital where rabies prevention is available. And as per WHO recommendation, wound of any dog bite or a contact of dog is categorized in 3 categories. One is just touching of animal. When the skin is intact, there is no bite, there is no skin break, and that is no category. And category 2 is just minor wounds, either with bite mark, scratch. If you observe a dog, the dog put its leg, sometimes the saliva is contaminated into the nail. So a scratch can also be infectious. Either scratch, bite mark, but all the superficial cuts without bleeding, minor abrasions are category 2, which is a moderate risk category in which vaccine series needs to be given. And all the deep lacerated multiple transdermal bites, they all come category 3, which is considered the highest risk category, in which, of course, wound washing, anti-rabies vaccine series needs to be given, but also rabies immune globulin, which is readily available, readily produced antibodies are given into the wound, around the wound, to neutralize the virus at the wound site. So these are the management of a dog bite after the exposure, and if all these steps are followed properly, so we can prevent rabies after the dog bite or after any animal bite which is infected by rabies. We can prevent it 100%.
Well, so that's fantastic. So this is what humans should do if they've been in any way come into contact with an animal whose own rabies vaccination you're not sure about. And this can be any animal, because I think, I keep saying it because I think that a lot of times we think that it's only dogs, but it's not only dogs. You can get it from any animal that is infected. But what are the protocols for keeping your animals safe?
Like I mentioned before, that there is a recommended anti-rabies vaccination program for usual pets that we keep are dogs and cats. And people keep mentioning, like you very rightly said, that 96% of the bites are because of because of dogs, only because we have dogs in our close proximity. And so we get the vaccine. Vaccine needs to be coming from a system where vaccine handling is, sort of spot on, and the required temperatures are made. And then you get the regular boosters. According to the
boosters are also really
absolutely
important.
very important. We normally get around the world 2 types of anti-rabies vaccine. One is good enough for 1 year, and the other one is good enough for 3 years. I always recommend that if we do it annually, So we, under our circumstances and under our power outages and, you know, all these sort of casual, sometimes with all due respect, attitudes.
This is true.
So we need to be as, you know, sort of vigilant and as careful, because it's a fact that once when the symptoms start, there is no going back.
In either human or animal.
Or animal. And, you know, there have been studies where, I don't mean to be very gross on the program, but where the brains have been exposed and antibodies have been poured on the brain.
Wow.
With no reversal of symptoms. Because the damage is all, virus multiplies in a certain portion of the brain, and that portion controls this cricopharyngeus muscle, which is in humans and animals, which is responsible for swallowing. So once when that part is damaged, so then that damage is permanent. It can't be regenerated, it can't be cured.
So this is why precautions are so important, and from what I understand is that there is no diagnostic test for rabies.
No, there is.
There is?
There is. For instance, if a suspected, you see, it's a specific protocol.
Okay.
It's not being a good vet or a good doctor. You follow the book in this case. So once when an exposure occurs, it's a simple, you know, it's a straightforward protocol.
Right.
You get like Aftab Sahab was mentioning, first and most important step is to wash the wound with a detergent. All over the world, again, I would like to mention that, you know, that series of seminars that we take, managed under Dr. Sajid Maqbool Sahab. We had doctors coming from the States to attend that. They came with the slides showing, even in the States, doctors bandaging the wounds. You don't do that. Because it has to be washed. Of course, it depends on the location of the wound and how much mutilation that has been, you know, sort of done. But if that can be avoided, it should be. So you wash it properly and you wash it with the detergent. No expensive antiseptics, no...
Which is what we've learned from COVID also, that ordinary soap, and if you just wash your hands properly, then you're all right.
Especially with rabies, virus is sensitive to two things. One is a detergent, which is ordinary household soap, and the other one is phenol, which is carbolic acid. So outside, you know, in other countries, we've seen household hand washes with carbolic soap.
Quite useful.
Very useful. And here also there are some soaps which are called carbolic soaps.
What is the vaccine protocol for rabies? Because, you know, I was half joking about the 14 injections thing, but it's not 14 anymore.
See, for humans, there is one shot which needs to be given as quickly as possible after the dog bite, and then there are slightly different protocols depending on the manufacturer. But then it's day 3, and then it's day 7, and then for certain it's day 14, and then day 28. So you get 4 to 5. But your question,
and you can't skip them. You can't. And you have to make sure you get all of them.
So 6 to 12 days is the incubation period in which the animal is kept under observation. And if, God forbid, there are these signs showing, so there is still quite a crude test in animals all over the world, which is still very valid, which is the gold standard. So they take the saliva and they inject it into a laboratory animal and then observe the symptoms.
Poor rat.
Poor rat, exactly, into the brain of the rat. And then they see if the virus is there, then it begins to produce rabies-like symptoms in that experimental.
And then you know that you need to start your course of injection.
Start the course.
Regardless of
what
animal.
happens. If the animal that you are observing for 6 to 12 days, if after 12 until 12 days the animal is normal, so then you normally, that's what's done all over the world. So you give only 3 shots.
Okay, so you have to start, you get your first shot immediately, regardless of the animal, then wait for the animal, and then you can decide how many shots you need.
If the animal is not vaccinated, which means that it has it doesn't have a passport.
Yes.
So if it has a passport which shows its vaccine dates and everything,
then you're okay.
Then you are okay, but then you should also not forget about washing your hands.
Right. So you still have to follow the other protocols, but you don't necessarily have to get vaccinated if you know that the pet is vaccinated.
For instance, for me, I get scratched, bitten all the time. So if the pet has been vaccinated, especially by myself or by my colleagues, so I know that they are dependable and the pet is all right.
Yeah. So that's also one important thing to consider. So we are not to sort of fly into a panic either. We're going to take a very quick break here. Don't panic. We'll be back in 1 minute. Stay with us. Welcome back to the coffee table. We're having a crucial conversation about rabies with Dr. Ahmad and Mohammad Aftab Goher. And we've been talking so much about how to treat it, how to catch it, because rabies is preventable. And I think that's the thing that I'm sort of really obsessed about now, is that it is preventable. It is a terrible disease once it takes root in the body of an infected animal or human. But there are many steps that can be taken to prevent that from ever happening. But one thing that I'm curious about, and Aftab, maybe you can tell me something about this, because of course you are in charge of these wonderful awareness programs, is that it seems like a lot of rabies happens when animals are exposed to wild creatures and get bitten by wild animals. But then how do infected animals in rural areas, how do they come to cities? Like, how does rabies transmit from rural to urban centers?
Well, it's a very important question. In fact, you see, when a dog gets rabies from a wild animal, and that may have happened maybe months and years back. And once that dog gets infected, so it has all the symptoms and it gets very aggressive and agitated. And because of the infection, it not only bites humans, but also bites animals and everything that comes into its way, maybe wood and stone and everything. And meanwhile, it can bite maybe a healthy dog and a healthy buffalo, a healthy goat. So the virus can be transmitted from a rabid dog to a healthy dog, and similarly to healthy livestock. Right. And so the virus is transmitted from infected dog to other animal, and so that the other animal who gets the virus can also transmit the disease to the human by the bite. Yes. But it is mainly transmitted through the infected dog. But that's how the cycle keeps going on. So one infected dog bites other healthy dogs, and virus is transmitted.
So what we're saying is that also if an infected rural, and I'm also now thinking of things like urban sprawl, where the distance between cities and, quote unquote, and villages is probably getting less also. And because rabies can be transmitted from any animal that's infected to any other animal, that means that if any of those animals just kind of amble along into a city or into an urban space, then there you go. Rabies has arrived.
All warm-blooded animals. Fish, dolphins, whales. Every virus has been isolated in almost every mammal, every warm-blooded animal.
Dr. Aftab mentioned livestock, and you are an expert with livestock, and you're working with cattle for so many years now. Well, like you said, all warm-blooded animals can get it. So is it dangerous if a cow has it, for example, or a horse?
Cow.
But since we eat cows, then
like that, it's not going to be sort of very well accepted what I'm going to say. But internationally, meat of a rabid animal can be consumed. It's allowed. Right. So it goes through, passes the the disease is not transmitted like that. But what happens normally is that in a rural setup and even in a modern farm, the animals are sort of kept in an enclosed space, and they can't run away.
Right.
So if a rabid dog or a jackal or a fox enters a pen full of animals, especially, let's talk about cows first. So they would want to all their defenses are through their head. And so they would want to butt it, or so they get normally bitten on the face.
Oh.
So that's why they
fight face first.
Fight face first. And like with the horses also, they get bitten. Once when an animal gets bitten, it shows aggression. Now cows shows aggression by butting or by becoming sort of aggressive. Horses can bite. So
Right.
they are, the horses do bite actually and kick. So they are, sort of kicking will not transmit rabies, but
Yes.
it will damage anything that comes.
And the same way, butting is not going to transmit rabies.
To transmit, but it can be, sort of very dangerous.
Yes.
So these are the two most commonly affected animals, and then our own household dogs and cats, like Aftab was mentioning that, because virus can sometimes come in the saliva before the onset of symptoms.
Yes.
In a true aggressive state, which is called the furious form, it only lasts for about 6 to 8 hours.
Oh, okay.
Right? And then we can only move our lower jaw, right? Not the upper jaw. So then there is paralysis of the lower jaw. So then the animal can't bite. That's nature's way of protecting, other animals from, because
it's literally like shutting the trap and saying you can't bite anybody else.
So
Game over.
Once when the jaw drops, so then they can't bite. And then the other most common symptom is it's an ascending paralysis.
Okay.
So first the tail usually of an animal is pushed to one side and it becomes flaccid, paralyzed. And then the hind quarters become weak, hind legs, and then it slowly sort of travels towards the head, and the animal begins to drag itself.
So one thing, and again, because we're reaching the end of our show, but I'm still, so many questions, so much curiosity. I know that a lot of approaches to the control of rabies and the control of rabies in dogs, because again, dogs are the most common, is culling.
Correct.
But there is also vaccination. So which of the two do you think, does there need to be a combination of these things? Or like, what do you think is the most effective way of controlling rabies in dog populations?
See, I would again like to, sort of specially congratulate and compliment Aftab Saab for, sort of initiating this program in Karachi. I was invited by Gayatri Devi, late Gayatri Devi in India, in Jaipur also. Now, when we talk about, these preventative programs, we always talk about developed world, and things going on there.
Yeah.
And we also always think that that's where they can, actually happen. But even in India, in just 1,000 square yard property donated by Her Highness, or the title. So that facility attracts experts from all over the world. They come and work on this ABC program, Animal Birth Control. So the whole idea is to pick up local animals, bring them in, fix them,
neuter them
or spay them, or whatever, male and female thing, fix them, and then put them back to their support areas. So eventually, and of course vaccinate them. So eventually, with the passage of time, you decrease the population
and the
gradually, and vaccinated. So vaccinated animals would not allow these other animals to, these adult vaccinated animals would not allow other animals to have access to those garbage dumps.
And would, if a vaccinated animal gets bit by an infected animal, will they get sick?
Yeah, they can get sick, provided these first aid measures, like washing the wound with the detergent thoroughly, and then revaccinated.
Okay.
So vaccination is of two types. Again, I would like to very quickly mention for both. One is this prevention, that, for instance, I get vaccinated every year. And then there is this PEP program, which is the post-exposure prophylaxis.
Okay,
That's
right.
a slightly different type of program.
Which is what we've been talking about, that after the event.
the exposure. So that vaccine preparation comes with a slightly different, sort of technology. Those vaccines are available here, best ones.
So, Dr. Saab, is it recommended that people who work with animals, such as yourself, they should just as a routine be vaccinated for rabies?
Absolutely. Absolutely. Because, just this phobia that, number one, it's like you mentioned right in the beginning, that it's still a lot of people still think that it's those 14 shots.
Yes.
And going into the peritoneum,
Yes.
or we call it into the stomach.
Yes.
But that's not the case. Number two, it's 100% safe. I mean, as a scientist, I shouldn't say 100%.
But extremely
it
safe.
is. It's much safer as compared to a lot of other vaccines that are around. And it has to be done because, God forbid, if rabies occurs, then that's
trouble.
It. And it's 100%, like Aftab has been mentioning, and all the literature says it's 100% preventable, provided proper first aid and prophylactic measures are taken.
Excellent. And thank you so much, Dr. Saab. And thank you so much, Aftab, for being with me on the show today. I think that Dr. Saab has summarized it in the most neat way. But the important thing is to remember that while rabies is a terrible disease and it's a horrible disease and it is fatal in almost all instances, it is completely preventable given that we vaccinate in a timely way and that if we are bit, we know what steps to take. And I think that those steps have been elaborated in succinct and clear detail on the show today. So thank you guys for watching. If you're watching this on YouTube, don't forget to like and subscribe, and we will see you next time on the coffee table. Bye.